We are going to be talking for several hours about juvenile orthopedic diseases. I have sort of divided the lectures into ones that I think will give a reasonable amount of information with the time we have without overwhelming. So part one, the first thing we're going to discuss today is going to be elbow dysplasia, one of the more common, canine juvenile orthopedic disorders. So elbow dysplasia. There's going to be, we'll talk about the signalment and presentation of animals with elbow dysplasia, the pathophysiology of the disease. It does present with several different things. It's considered a syndrome, elbow dysplasia, because it can have 1, 2, 3, or even more different lesions that lead to overall elbow dysplasia. We'll talk about how it's diagnosed. There's different methods, which ones are best, which ones are most commonly used. And then the two major parts of the syndrome, we will talk about how they're treated, best treatment, when, how, and overall what you can expect for an outcome for these young dogs that are diagnosed with this condition. So the signalment and presentation of dogs with elbow dysplasia. So it's not something you'll see in every dog, but certainly young dogs, any dog under the age of 1 with forelimb lameness, you should be thinking along the lines of a developmental disease. And certainly in the forelimb, you're going to be thinking shoulder, elbow, but not necessarily in that order. So if you see a dog in practice with intermittent lameness, so the owners come in, they say, he runs around and then he's really lame on his left front, but then the next day he seems like he's okay. Or maybe they come in and say, we were playing fetch and he was lame. It seemed like it was in the front, and then the next day he was definitely lame in the right front, and then he seemed okay for a week, and then he was lame in the right front. This kind of thing, any kind of intermittent lameness, if it's a dog that's young, again, under the age of 1, you want to be thinking about a developmental disease. Question the owners, get a good history, when does it happen? How long does it last? Do you do anything about it? And if you do, does it help? Typically, elbow dysplasia is a condition of large and giant breed dogs. So you're going to see a lot of this in your Labrador Retrievers, Golden Retrievers, German Shepherds, any of the larger giant breed dogs, even something like a Basset Hound. They are considered a large breed. They're huge. They just have no legs. Typically, these dogs present around 8 to 10 months of age. They can be younger, and they certainly can be a little bit older. If it's a mild elbow dysplasia, they may not show signs till they're a year. Much over a year, and you're going to have to start thinking about other things, but certainly don't rule it out. On your physical, you will see lameness when you watch them walk, and there will be pain on manipulation of the elbow. Those two things are consistent. If they're not lame, of course, the owner may say, well, he's been lame, he just isn't lame in the office. That is a possibility. You can never forget, especially with a painful condition, they get a overload of cortisol when they come into the office. They're scared, they're nervous, and it can mask pain. But you should see lameness and definitely pain when you manipulate that elbow. So those two things are consistent. The elbow will have reduced range of motion, so the elbow joint won't move normally. Always, always, always examine both legs. Even if the owner swears the dog has only ever been lame in the left, examine both the left and the right. If the right is normal, it's great because it gives you a comparison. And if the right is abnormal, then you probably have bilateral disease. So this disease can be bilateral. It can be unilateral. A lot of times they'll show lameness and pain in one elbow, but there's actually changes in both. So, and oftentimes the elbows are swollen. There's fluid accumulation, or there's scar tissue formation. All right, the pathophysiology. So how does elbow dysplasia develop? The basic pathology of elbow dysplasia is caused because there is uneven growth of the humerus, ulna, and radius. So the elbow joint is where these three bones come together. Obviously, you know what an elbow is. It is a complex hinge joint. So the humerus does have a joint with both the radius and the ulna, and the radius and the ulna also have a joint. So it's a complex joint. There's a lot going on in there. That means there's a lot of places where you can have problems. And all three bones need to come together correctly in order to not have a problem. So the three bones, they have multiple growth plates. They have multiple ossification centers, and these all need to close at the proper time in order for the joint to be normal and have normal function. You don't want to have any of the bones grow at a different rate. So normally you will have, or not normally, but in elbow dysplasia, you'll have multiple abnormalities that are present in the joint, not just one. Any abnormality in any of the three bones affects all of the other ones. The other thing is, because these are large dogs, as they grow, changes in one area of bone will change all the other bones in the area. So you quickly get abnormal wear and tear of the cartilage, and that causes pain, degenerative joint disease. So because they're large dogs, things change fast, and it doesn't take much for one of the bones to grow differently than the others and to suddenly develop an abnormal joint. All right, so as I said, there are different components of elbow dysplasia syndrome. There can be all sorts of things going on in the joint, but these are the most common. The biggies are an ununited ankle process. So on the slide that you're looking at, the white line, that's the ankle process or ankonial process of the ulna, of the radius. And that ununited ankle process is probably the most common single abnormality in the joint. Another common thing you'll see is what's called fragmented medial coronoid process, or FCP, and that is shown on the orange line. I'm getting my colored lines incorrect. The black line on the picture. And then OCD of the medial humeral condyle, we're going to talk about when we talk about OCD. It's common, but it's OCD, so we'll talk about it with OCD. That's the orange. So mostly today in the elbow dysplasia, we're going to talk about the ununited ankle processes, UAPs, and fragmented coronoids, FCPs. Those are the most common. OCD in the elbow is certainly common, but it goes along with OCD everywhere else. All right, so an ununited ankle process. Let's see here. Let's just go back here for a minute. All right. I'm assuming you guys can all hear me. If anybody has any questions, please sing out. Hopefully we'll have time at the end. But I don't want anybody to be totally lost or say at the end, I couldn't see your slides or anything like that. So. Okay. So ununited ankle process. This X-ray is a pretty good indication of what it looks like. So the white arrow obviously is pointing to it. Go back. This is in the same, it's the same elbow in the same direction, so that's helpful. And then you can see what happens if it's not united. So the anconius should fuse with the olecranon at 5 months. Some dogs it'll take a little bit longer, but it should be fused by 5 months. If it doesn't fuse, then it's unstable and it can actually detach from the rest of the ulna. This radiograph, that's not completely detached, but it's a very unstable process. So it's an unstable piece of bone in the joint. Anytime you have that, you have inflammation. Inflammation will eventually lead to osteoarthritis if you don't do something about it. So this dog is going to become, it's already probably painful, swollen joint, intermittent lameness, possibly chronic lameness. And if you don't do something about it, it's going to develop elbow arthritis. And then once you're there, there's no going back. So the Underlying causes of ununited ankylosing process are multiple. Familial genetics, certainly there are certain lines of dogs. If you've got Labradors, you should, be asking, is there a history of elbow problems in this line? A lot of people, unfortunately, don't know to ask. They should be asking the breeders, have you had this dog's hips and elbows checked? Does this dog have, a history in its family of hip problems or elbow problems? But a lot of people don't know to ask, or don't care, or just get the lab because it's cute. But familial genetics, certainly there is more elbow problems in certain lines than in others, but genetics is not the only answer to anything. Hormonal factors, so there's a lot of discussion about, is it more common in males or females? Do you have more problems if you spay and neuter early? Do you have more problems if they're not spayed or neutered? If they have other hormones, if they're hypothyroid, although young dogs, don't usually have that problem. Growth hormone disorders, certainly if you have abnormal growth hormones, that can cause a problem. Again, this is a process that involves a lot of things coming together and happening all at once. And if everything doesn't happen in exactly the right order and exactly the right way, then you can end up with abnormalities. So, and then another underlying cause would be any kind of growth plate trauma. Again, we're talking large and giant breed dogs. So these dogs are growing rapidly, and they're growing for a long period of time, generally until they're about 2. So if there are periods of trauma during that long and rapid period of growth, that can lead to dysplasia. So that's part of the reason, you should really be discouraging the owners of these large and giant breed dogs from letting their puppies be overly active with certain types of activities at a young age. During this period when all of these different growth plates are closing and ossification centers are closing and things are changing rapidly in the joints, they shouldn't be going on runs on the pavement. They shouldn't be doing, 10-mile hikes on hard ground. They can certainly play, but hard, repetitive, traumatic joint activity is not recommended. Also, dogs that have this UAP often will develop a fractured coronoid and possibly OCD. So a lot more dogs have more than one problem than have an isolated problem. Most studies, they'll say up to 25, 30, maybe even 35% who have one have something else. There's not a lot who have just one problem. So dogs that have a UAP, generally they'll present to you at 7 to 8 months. They'll have a slight limp or an intermittent lameness, and their elbow will be abducted, so turned out away from the body. When they walk, you'll notice that front leg swings out to the side, so they have a lateral swing while they're moving. So in what's called the swing phase of the gait, they'll abduct to the side, and it can be pretty noticeable. When they're standing, their foot is generally turned out on the side that's lame. So they stand there sort of cockeyed, and then they always want to turn the elbow out. When you're examining the joint, you have to be careful not to rotate yourself. It's very easy to pick up the foot and rotate the elbow outward and then say, oh, his elbow is rotated outward. And actually you're the one doing the rotating. So just keep that in mind when you're doing your physical. And also the elbow joint will have a limited range of motion because of the pain and the inflammation and swelling. There's generally either fluid in the joint, or if it's been going on long enough, you'll have swelling from early osteoarthritis or early changes in the soft tissues. So swelling, pain, lameness, lateral swing, elbow, dog under 1 year old. All right, the second most common, or the second common part of the syndrome would be a fracture or fragmented medial coronoid process. It's not fractured because wasn't normal and then broke. It's fragmented because it never really formed normally. And it generally is just referred to as an FCP or fragmented coronoid because it's always on the medial side, but it is the medial coronoid process. The radius has a lateral coronoid process, but that doesn't cause problems in the joint. The medial process actually articulates with the ulna, as you can see in the x-ray, and that articulation should be normal, and in the case of a fragmented coronoid, it's not. So it presents similarly to any of the other causes. You can't really tell on your physical what's going on, but it, like I said, it does have a joint surface. It articulates with both the ulna and the humerus. So any change in that coronoid is going to change the relationship between the radius and the other bones, and that can lead to pain, swelling, intermittent lameness, changes the articulation of the whole joint. So that's another possibility, a hot spot you should be looking at. So these things, if you have multiple things going on, sort of the other than OCD, which I said we're going to talk about when we talk about OCD, the fourth part of the syndrome, so to speak, is significant joint misalignment, which generally is just multiple of these issues going on, and then it leads to the joint being badly misaligned, and a badly misaligned joint will look like this. They can be pretty ugly even in a young dog. So if it's not properly aligned, you get degenerative joint disease pretty rapidly. You lose function of the elbow. The elbow can fuse or arthrodese pretty early, and you get chronic pain. Once you get to this point, it's pretty hard to treat. So you want to treat these developmental abnormalities when the dog is still young. A lot of times the owner's like, well, can we wait and see if he gets better? Can we try this for a few months? Can we do this, that? They can. It's certainly an option. There's always a lot of options for treatment. The owner never has to do any one thing. But if you don't treat early, you need to warn them, these changes become chronic, and then it can be pretty hard to treat. A dog with an x-ray like this is going to be pretty hard to get good elbow function. All right, so how do you diagnose elbow dysplasia? Well, like we talked about, your physical and your history is going to really lead you to the elbow is the source of the problem. The dog's going to come in either limping on the front leg, or the owner's going to say, I swear he limps on that leg all the time at home. He's just not doing it now. Again, it's probably because he's in the clinic. So you're going to do your physical. He's going to have pain, swelling in the elbow, decreased range of motion. You should be able to tell on a physical when you do a thorough physical, both front legs, toes to shoulder, that the issue is in the elbow. So your first diagnostic tool is going to be radiographs. They're very, very helpful for diagnosis of any of the developmental orthopedic conditions, and you should never skip them. There's no reason not to do a radiograph. They are sensitive enough for a lot of elbow dysplasia. They may not be sensitive enough if you have really mild lesions. There's certainly lots that are missed, and I've certainly missed, an early UAP or an early fragmented coronoid because it just isn't showing up on the x-ray yet. But most of the time you'll see something. You'll see some sort of incongruity in the joint. You'll see early changes in the bone, or you may just see a step off. But if you do and you need to take the right x-ray, you need to flex the elbow as far as you can. A completely flexed radiograph is going to show you all of the areas we talked about. You can really see the anconeal process. You can really see the condyles and the coronoids. You should be able to identify everything, but you've got to flex the elbow hard to get the x-ray you want. That's the kind of flexion you want so that you can see everything. Like you can tell in this picture, you can actually see this ununited anconeal. You can see your coronoids. You can see the surface when we talk about OCD, the whole surface of the humerus. This is a growth plate that hasn't closed, not a problem, nowhere near the articular surfaces. Right, so if you're not seeing anything on x-ray and you have an owner who's willing, CT is great. It's much more sensitive. You're not going to miss anything on CT. But not every client has access to CT or the ability to afford CT. So, again, like so many things in veterinary medicine, yes, it would be great to just do a CT of every dog, but that's not something you're going to be able to do in practice. So CT is the gold standard, most sensitive. If somebody said, I can do one test and I need to diagnose this dog, do a CT. Arthroscopy is another one. Arthroscopy is not as, it's certainly more available and possible for a lot of clients to do. The nice thing about arthroscopy is if you've got a high index of suspicion, maybe you've already done a radiograph and you think you see a small fragment. Arthroscopy you can use to both diagnose it and potentially treat it if you've got the ability to do arthroscopic surgery. So arthroscopy is a good one too. All right, so what about treatment? So we've got, excuse me, boy, I've got a real frog in my throat. We've already discussed, you know, we've diagnosed this dog. It's a young dog. It's got problems in the joint. You know, it doesn't have a joint that looks like this, luckily, but, you know, maybe it has something like this, which is a blunted, you know, medial coronoid that's not normal in shape and therefore isn't articulating correctly. Maybe it's got something pretty obvious like this fragment here in the, you know, anchoneal process, which is not normal. And, you know, we need to do something about it. So young dog, intermittent lameness, swollen elbow, painful elbow, decreased range of motion in the elbow. Discuss, you know, what does the owner want to do? Certainly you should always be talking about what is your, sorry, just checking in with the chats. Okay, sorry, I guess I'm going a little bit fast, so I can certainly slow down. We've got all kinds, we've got all kinds of time, so I will certainly try to slow down. And, you know, treatment is sort of the end, and then we'll go back through and discuss the whole thing again. And feel free to throw questions into the chat if you've got them, because that's what I'm here for. All right, so before I talk about treatment, we'll just go to a quick review here. So again, owner comes in, intermittent lameness, young dog, larger giant breed, you know, classic presentation, come in with a 7 or 8 month old Labrador. You know, we went out to the lake yesterday and threw the stick for him and he loved it. And then we got home and he was limping on his left front leg. And then this morning he seemed like he was okay. And then, you know, we went out and threw the ball a couple of times and then he seemed like he was sore again. So that kind of thing. He comes in the office and he is walking with he's taking his left front leg and it's swinging out to the side. He's favoring it a little bit. You certainly have pain when you try to manipulate the elbow. So you're thinking, uh-oh, this is a young dog with a sore elbow and it's a Labrador. So probably elbow dysplasia. We talked about where the problems in the elbow could be. You know, the biggies are the ones that we talked about, but it can be anywhere in the elbow. You can't tell from your physical, but there's changes going on in there. There's something going on with the growth of the 3 bones that form the joint. There's something going on with the cartilage. The growth plates and ossification centers may not be normal. No idea at this point how severe it is, but you've got a pretty good index of suspicion that you're dealing with developmental disease. Then we talked about the most common components. And again, we will talk about OCD of the condyles when we talk about OCD. Right now, we have ununited anchoneal process and fragmented coronoid that we talked about today. Those are ones that are common and that you were more likely to be able to pick up on x-ray. Certainly you can see on arthroscopy, and then they are, if they're bad enough, they can lead to that really bad joint misalignment, especially if the growth rates are significantly different. And in the giant breed dogs that grow fast, it doesn't take long before you got a pretty serious problem. So we talked about this, which is when the anchoneal process of the ulna doesn't unite or doesn't, you know, ossify the way it's supposed to, and instead it's free floating in here. We talked about the fragmented medial coronoid. So this piece, the medial coronoid process of the radius, is not normal. And again, you're not going to be able to look at an X-ray necessarily and say, yeah, that coronoid's abnormal. I mean, you have to look at a lot of radiographs of elbows to be able to pick it up. This one is what's called blunted. It should be a sharper. Normal elbow in here. Oh, this is normal elbow. So it's pretty subtle to tell the difference between the one on this x-ray and the abnormal one. But it is blunted. Let's go back to normal for a second. See if I can. Unfortunately, they're very different x-rays. This one is complete flexion and it's oriented in the opposite direction than this one. But anyway, that's an abnormal one. And then obviously, if you see something like this, you're going to know there's something wrong with that. Okay, so we're there. We have done our exam. We've picked up pain, swelling, lameness in the elbow of a young large breed dog. We're thinking, uh-oh, this could be a developmental problem. Could be elbow dysplasia, could be OCD, which is part of elbow dysplasia, but maybe a little bit different. Could be a traumatic injury. I mean, we don't know that it's a developmental disease. Just because the dog is young does not rule out traumatic injury. So you also have to keep that in mind. Young dogs are perfectly capable of causing trauma. I recently, well, not so recently now, but I had to repair a fracture in my daughter's young dog who fell out of bed and broke his leg. So just because he was young doesn't necessarily mean it was developmental. He just was a young dog with a traumatic injury. So it's, you know, it's high on your list. Certainly not the only thing on your list. So we talked about diagnosis. Radiographs are certainly the best place to start. But if you don't get your answer on radiographs, the other thing about radiographs of the elbow is they're a good one if you have the option to do this wherever you're practicing. These are a good radiograph to send in to a radiologist. If you are thinking, you know, that coronoid doesn't look quite normal to me. If you send the radiograph to a radiologist, you'll probably get more information. And if CT isn't an option, that's another way you can go, is to refer your radiographs out. It's always a good thing if, you know, if you're like, well, I'm kind of suspicious, Chuck, you know, as they say, well, I can't really afford a CT. I don't really want to go to surgery and do arthroscopy yet. Is there anything else we can do? Send them to the radiologist and they'll, you know, they may come back and say, oh yeah, that medial coronoid is definitely abnormal, or that anconeal process should be fused at this point. It's not. Unfortunately, you know, that you may refer it to a radiologist who charges you a lot of money and then says, yeah, it's not diagnostic. I can't tell from the radiograph, but it is another option. So keep that in mind. All right, so let's go through treatment and then we can go back and questions or review or whatever. So treating UAP, again, the anconeal process should fuse by 20 weeks. If x-rays show that fusion has not occurred, then you really should go to surgery before degenerative joint disease comes or gets worse. You want to, what the idea of surgery for UAP is to remove the fragment. The simplest surgery, the most common surgery, is to just go in and remove the fragment before there's any secondary change in the joint. The removal of a fragment will cause some instability in the elbow, but it's mild. You have removed the source of inflammation, and generally these dogs do well going forward. The other option for an ununited process, especially if it's a large piece, is to reattach it. Reattachment is difficult. It's definitely something for an orthopedic surgeon, not for a general surgeon. You can reattach it with a lag screw, but you have to get perfect anatomical alignment or else you're just going to make it worse. You're basically going to take a fragment that's free floating and you're going to permanently fix it in place. And if you fix it in place incorrectly, then you're basically causing degenerative joint disease. So don't try to do it yourself. It's not probably the best option in most cases, unless you've got a very big dog or a very big piece and you're going to have too much instability if you just remove it. So the best thing is generally to remove the fragment and then immobilize the elbow for a short period of time. You don't want to immobilize these dogs for very long because they're growing and they're using the joint, and if you immobilize it for too long, you will cause the joint to fuse and get stiff just by immobilization. So similarly, when you treat FCP, you've got a fragmented process. You may or may not be able to see it on the x-ray, but you've diagnosed it, you know it's there. The medial coronoid does, again, articulate with the humerus. So when it's not properly aligned, it's touching the humerus, but it's only touching it on a small amount of space, and probably too much. You have too much of a connection between the two bones, but only over a small surface. And you've got a very big dog walking around on it. So that's putting a lot of stress on an abnormal joint. And lots of stress on an abnormal joint is going to very rapidly destroy the cartilage. So you can end up with either the coronoid fragmenting and breaking off, which causes more inflammation and leads to DJD. So you really want to go in and remove that fragment. Again, if they walk around, the longer they walk around on it, the more they're going to damage the cartilage, the more the elbow is going to become abnormal, and that's not what you want. So similar to treatment for UAP, you want to go in and remove the little chunk. That'll remove the stress, stop for the joint damage. So these conditions, these developmental bone conditions, are often surgical, but you want to do your surgeries early. Because the goal of treating any of these young dogs is to produce, produce a joint that's as close to normal as possible. They're never going to have a completely normal elbow, and you need to make sure the clients are aware of this. Again, client communication, everything we talk about ever, client communication is key. They need to understand you're not fixing this dog. You are treating the condition, and your goal is to make them as good as you can. The biomechanical forces in the joint are very closely balanced, and you need to try to get that balance back as best you can. Otherwise, you're going to get cartilage degeneration, osteophytes, and you're going to get DJD, developmental joint disease. Degenerative joint disease, sorry. And that degeneration will happen eventually, just a matter of when. We're trying to put it off as long as we can. So early diagnosis is your key. You want to try to avoid letting them say, well, can I just wait a few months and see how it goes? It's always the client option to try. You could put them on medication, send them home, keep them quiet. They'll probably do better. They'll be less painful because they're not doing as much. It doesn't mean the problem's gone. It just means they're not as active. You take them off the meds and bring them back in 3 to 6 months later, and they're lame. So you've lost some time, and the elbow has gotten worse. So you really want to get in there before permanent changes occur. And then after surgery, assuming they go ahead and do it, say they remove a little fragmented coronoid, they want to be on a lifetime of diet. Keeping these dogs at a healthy weight is key. If they get heavy, they will get arthritis fast. Their exercise routine, it's not that they can't exercise, but there's certain high impact exercises will not be a good idea for them. Again, running on the pavement, doing things that really pound that elbow. And then supplements, which, we're not going to get into that whole thing right now. It's a huge subject, and there's, I won't say it's as controversial as it used to be, but I'm a big proponent of joint supplements. Some people are, some people aren't. I think all of these dogs should be on joint supplements for life. It certainly helps produce healthier cartilage in a healthier joint environment, and it will slow the progression of the OA. So any dog with elbow dysplasia is going to get OA in the joint. Your goal of treatment is to minimize that, OA being osteoarthritis. Your goal in treatment is to minimize the amount of osteoarthritis and minimize the amount of physical damage, and also maximize the amount of time before that takes place. So it would be great if you saw the dog, at 8 months, you x-rayed it, you see, the anchineal process has not completely ossified. We've got this piece here, so it's ununited. I can see it on the x-ray. You talk to the owner and they say, yeah, I want to do something before it gets worse. It's a small piece, so you can go in, you can remove that little piece, flush out the joint, remove all your inflammatory mediators, keep the elbow relatively immobilized for a week or so. Discuss with the owner how important it is to keep this dog's weight at a healthy weight, how important it is for them to walk, swim, do exercise that's not as high impact on the joint, and possibly put them on a joint supplement. And then you may have a dog that doesn't have any more problems with that elbow until it's 7, 8, 9 years old. Then it might start to get a little bit stiff because its elbow is a little more unstable on that side than on the other side, but it's certainly better than it would have been if you hadn't done anything. So that is your goal. Let's see. All right, so hopefully slowing that down made things a little bit better for you guys. Looks like 1 or 2 of you is still hanging out. So that was a brief summary of elbow dysplasia. Again, we will talk about the OCD part. We'll talk about OCD, the medial condyle, when we talk about OCD, because OCD is a big subject. But elbow dysplasia is a syndrome. It's caused by any one or more likely multiple abnormalities in the elbow joint. So generally these dogs have an ununited process and a fragmented or a cornoid that's abnormal and will fragment. And then because of that, they may develop OCD, and then you may end up with those significant joint changes. So it's a syndrome that you're unlikely to see one of these things without something else. If they have OCD of the condyle, they probably have a UAP. Or if they have a fragmented cornoid, they probably have a UAP and or OCD. So they, again, it's a syndrome. It's not a single problem, and you can end up with this. This is not what you want to see. And I have seen elbows like this in dogs under a year old who either weren't diagnosed or were never presented by the owner. They thought the dog was just overdoing it. And that's reality. You're not going to see them all in time to fix them. And not every owner is going to want to fix them. So you're going to see some that, look like this. You say, oh, your dog has elbow dysplasia and we should really do X, Y, Z. And they say, well, I don't really want to do that right now. It seems like an awful lot. Can we just put him on some pain meds and keep him quiet and see if he gets better? Realistically, that's what you're going to see. But ideally, what you want to do is explain the situation. Say, you've got this German Shepherd that's going to be 100 pounds when he's full grown. And if you really want him to be able to run around, to be comfortable on that right front leg, we should do something about this sooner rather than later. So again, client communication, it is key. Diagnosing, radiographs. Send the radiographs to a radiologist if you're not sure. If you've got an owner that's gung-ho, and they have this really expensive St. Bernard that they, is only 7 months old, and they want to do everything, say, you know what, let's take him and send him somewhere for a CT. Or maybe you're working somewhere where you have CT. And you're going to get every piece of information you need on that elbow. You're going to get all the bones, all the cartilage, all the soft tissue. You're going to be able to see everything. And then you'll, probably be able to refer to an orthopedic surgeon. Likely it'll be surgical. And then when that dog weighs 180 pounds, he's not going to be limping around on that bad front leg. So, and again, arthroscopy, don't forget about arthroscopy. You can actually do contrast radiographs right in your clinic. You may pick up a fragment that you didn't see on plain radiograph. And then if you have arthroscopy, you know exactly where the fragment is and you can go in and remove it. And even if you don't have an arthroscope or you're not comfortable using an arthroscope, at least if you send them somewhere, you can say, look, this dog has this fragment. I've seen it. Needs to be removed. And that is elbow dysplasia in a nutshell. We've got some time left. So again, if you have a question. So the question is, if the dog is not showing lameness, can elbow dysplasia go unnoticed? Yes, definitely. That's a great question, because elbow dysplasia is something that if they have it as a puppy, and a lot of them won't be lame, or again, they won't have a lameness that the owner notes. So let's say you have a 4 or 5 year old Labrador. It comes in and it's been lame in the right front. The owner says, he's not always lame, but if he overdoes it, he gets lame in the right front. You do your physical exam, nothing really outstanding except, the right elbow is a little bit thicker than the left elbow. The right elbow doesn't flex as much as the left elbow. And you're like, well, there's something going on with this elbow. We should take a radiograph. You radiograph the right elbow and you see, you see something. I'm not going to say you see this, but you could certainly see like this. The difference being that instead of this being clean, you probably have a lot of bony change in and around here, because this ununited process has been here now for, I say the dog was 5 or 6 years. And you've had degenerative changes, but the owner didn't know because it was very mild. You can have very mild changes here, and especially with your coronoids, this is a pretty subtle change, and you'll probably end up with pretty subtle changes in this joint space. And you may not have a dog that's lame at all until they develop degenerative joint disease or osteoarthritis. So yes, absolutely, elbow dysplasia can go unnoticed until the dog is older. And then when they're older and they have osteoarthritis or degenerative joint disease, there's nothing you're going to be able to do at that point about the dysplasia. It's already, whatever's going on in there has already undergone chronic bony change. So now you're left with treating the osteoarthritis, treating the degenerative joint disease. So yes, that's a great question. Elbow dysplasia can certainly go unnoticed. A lot of dogs, middle-aged and older dogs that are diagnosed with OA or osteoarthritis in a joint that probably started because the joint wasn't normal from the beginning. So that goes for elbow dysplasia, OCD, hip dysplasia, OCD of the shoulder, which we'll talk about, any of the joints. If there's any abnormality when the dog is young, it will lead to degenerative joint disease or osteoarthritis when the dog is older. So yes, the answer to the question is yes, you can certainly miss it. And the owner can miss it. You may not know they had an abnormal elbow. They may never show, again, like you said, they may not ever be lame to the point where you notice it. There's changes going on in there, but depending on the dog, especially Labradors, I've seen some Labradors that are so immune to pain, not immune to pain, but they're so overwhelmed with other feelings and hormones, and they're so happy and want to play and run that they don't care about the pain, and they're not going to limp. They're just going to run around. And then by the time they're 6 or 7, they're pretty lame. Dogs do bear 70% of the weight in the front end. So, those front legs take a pounding when the dog's big and active. So you may not see anything until they're middle-aged or older. Okay, anything else? Oh, good. Calcium supplements, another good question. So calcium supplementation after surgery. Generally, supplementing any one element is not a good idea. Calcium supplements are not recommended on their own for any of these bony things. Let me go back. Canine juvenile orthopedic diseases are not as a result of well, in most cases, they're not a result of lack of calcium in the diet, lack of phosphorus, abnormal calcium phosphorus balance, unless the owner is feeding a homemade diet and they haven't been getting adequate calcium, or they haven't been getting calcium that they can absorb and use, or they haven't been getting calcium with phosphorus and vitamin D so that they can use it. But for most dogs, especially if they're on a high quality commercial diet that is properly balanced, then the calcium level was not the reason. Matter of fact, in large and giant breed dogs, it's generally recommended that you don't oversupplement them with things like calcium and phosphorus, because you don't want the bones to grow too rapidly. It's actually better for these dogs to reach their ideal full adult size later and grow slower, because they're much less likely to develop these developmental diseases than if they grow fast. So you certainly don't want to put them on supplements that are going to speed up their growth rate. And if you do surgery, then after the surgery, you continue to feed them the diet that they've been on that has the proper amounts, the recommended amounts of all of the nutrients, including calcium. But you don't want to give them excess calcium, because then you're just going to cause more problems. You could potentially end up with more osteophytes, more bony growth. It's not what you want. So great question. But no, supplementing, especially supplementing just one thing like calcium, is not recommended. So can dogs fully recover joint function? I would not say fully. I don't think any dog that's had joint surgery, or any person that's had joint surgery, is going to have a 100% normal joint after the surgery. But function, certainly, say you do the surgery on a 7-month-old dog and it had a small fragment of the coronoid, and you remove the fragment and the dog did well after the surgery, that dog is going to have a pretty normal elbow. It will be a little bit less stable, because the process is there for a reason. Anytime you take out a little piece, even though the piece in that particular dog is abnormal, you are still taking out a piece of the joint or a piece of bone that was supposed to be there. It's there for a reason. So you've got a little bit of abnormality in the joint, and at some point down the road, the dog is going to have a problem in the joint. That being said, when the dog's 2, 3, 4, 5 years old, that dog will have completely normal elbow function, because you did the surgery. So they'll be able to run and play and hunt and jump and do everything that they normally would have been able to do. So the elbow will work correctly, especially flexion. Flexion is what you usually lose when you have an abnormal joint. So they will have joint function, say 90, 95% normal joint function for a period of time after the surgery. How long depends a lot on, do you keep their weight down? Do you have them on a good exercise program where the joint gets used but doesn't get pounded on? And are you feeding them a well-balanced diet that has everything they need without over-supplementing? And, some of it has to do with just how big the dog is and how much force they're putting on the joint. So I wouldn't say they can fully recover joint function, but their joint function will be so good that you won't see anything clinically until later in life. At some point, they will develop some degeneration in the joint, but it may be when they're 8 or 9 years old, and they may have developed DJG at that age anyway. Great. Okay, if you don't have any more questions, thanks, and we'll be back to talk about more developmental orthopedic problems.